Hi everybody, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today I want to talk about the public health emergency and telehealth. The public health emergency, or PHE, that is federally declared by the government, is possibly going to come to an end here in a few weeks. In July, it was extended for another 90 days, which means that the government will be reevaluating that. Here on October 13th is when the decision needs to be made to either extend the public health emergency for COVID or to end the public health emergency. With things going back to normal and a lot of requirements being lifted and restrictions being lifted and people kind of getting back to their normal way of life, I have a strong suspicion that it may come to an end. What that means is that the CMS rules for telehealth is actually going to start converting back to the old requirements prior to the pandemic. Telehealth rules and regulations were very quickly redesigned at the start of the public health emergency in 2020 to accommodate people getting care from their medical providers, but being able to be safe and be at home. With that, they lifted or they relaxed a lot of the requirements that had to do with the originating sites and what kind of medical clinics were able to offer telehealth. And there were quite a few tough, in my opinion, stipulations that you could actually bill telehealth prior to the COVID issue in 2020. But then when 2020 came along, they locked down a lot of things and they realized people still needed to continue seeing their doctors to have their life-sustaining medications filled and to check in on their patients, but they didn't necessarily maybe need to come into a clinic because it wasn't safe for them or they weren't comfortable coming in. They relaxed a lot of those rules and they kind of came up with some other stuff that has been working, actually, it seems like, pretty well for the most part, but they have been very honest with everyone that as soon as the public health emergency gets lifted and things are no longer considered under a health emergency, that the telehealth stuff is going to gradually go back to the original way it was. Now, there are people in Congress and other parts of the government that are fighting for more relaxed, if you will, stipulations and continue telehealth kind of the way that it's going now, because it has shown some success in some places. But they're going to give, I think it's 150 days of transition. So it's not like once the public health emergency is over on October 13th, it immediately goes back to the old telehealth requirements. So that's good. Providers, clinics, entities will be able to plan this with their patients as well and inform them of a certain date where they'll no longer be able to offer the telehealth services that they have currently been offering the last few years. But like I said, there is some legislation out there to try to get some things to be a little bit more lax or open up a little bit more of this, but only time will tell. But I just wanted to do a video to let people know that there is a chance coming up in a few weeks that you're going to have to start that transition with your patients, and you'll want to make sure that you're staying in the know, you're checking out the HHS website, the CMS website. Hopefully you've signed up for the newsletters with CMS so that you are kind of understanding, because remember that commercial insurances ultimately follow what Medicare does. And so even the commercial plans who have kind of been lax on their requirements are probably going to transition back to the old way as well. And, it's nice because so far, people were waiving some co-pays for telehealth, or they were covering it the same way as an office visit instead of reimbursing less. And you could do audio only. So like people that, don't have a camera and a computer and stuff, they could do it over the phone, and that was considered an appointment. A lot of these things are going to go away. They have made some changes for mental health, behavioral health though. So if you're in that field, I would definitely check it out, because some of those things are going to stay with some extra kind of requirements, but pretty pretty easy requirements in my opinion. So if you're in behavioral health, mental health, not everything's going to change back to the old way for you. So definitely make sure you're checking that out. But definitely keep this in mind with that public health emergency. Like I said, October 13th, it's coming up really fast. We want to make sure that we are planning appropriately in the clinics and for our patients, and just being sure that we're staying on top of it as much as possible so we can communicate and put a game plan together for our patients. And then also stay up to date on any changes that might happen during that transition period of like 150 days or whatever, in case they do end up allowing some of the things that have been going on, which would be very helpful in a lot of ways, I think, from what I've seen so far over the last 2 years and the utilization of telehealth. I know it has been beneficial, especially for the older population or people who maybe aren't usually ones to go to the doctor, but because they were able to do a telehealth with like maybe an urgent care or something, they were more likely to get treatment. I'm very curious to see what these numbers are, if the statistics can be shown, if people were getting better care or more people are going to the doctor because telehealth was available. I don't know. I'm just curious myself, but let's all stay in the loop. Let's try to help each other stay in the loop. I will do the best I can. I am going to put some links in the description of the video that will help you on where things are right now. And hopefully you can bookmark those and check those websites as things, develop over the next few weeks, months, to see what happens and how it affects you at your clinic. So public health emergency, telehealth, definitely need to stay on top of it. There could be changes coming down the road, and I don't want you to get caught red-handed or sidetracked on something else and bam, it hits you and you can no longer practice kind of the way you've been practicing with your patients. So anyway, leave a comment if you have anything to say about this for me. Smash the thumbs up if today's video was helpful, and subscribe to my channel if you haven't already. Thank you so much. Take care of yourself. Bye-bye.